This is Denise Beery. I am a student at Indiana State University in the LPN to RN BSN program. This is a community health nursing health education project. I will be discussing the topic on access to healthy foods in low-income communities. The risk group in this discussion involves populations living within low-income communities. The learning objectives discussed are as follows. Name the barriers to healthy food access. The importance of having access to healthy foods. What is a food desert? Strategies for improving food access, and current programs available for accessing healthy food. Please pause the video and check your knowledge by taking the pretest, which is in a link below the video. Healthy food access is important to improving population health. According to Healthy People 2020, studies show that there is a correlation between the inability to access healthy food choices and the development of negative health consequences. Examples given by Healthy People 2020 included a study conducted in California that showed a higher risk of obesity and diabetes in communities with fewer fresh food produce sources and a large amount of fast food restaurants and convenience stores. Further, according to the CDC, poor diets can lead to chronic illnesses such as heart disease, type 2 diabetes, and obesity. Healthy eating can lower the risk for chronic disease. What are considered healthy eating patterns? Well, according to 2015-2020 Dietary Guidelines for Americans, healthy eating patterns should include a variety of vegetables, fruits, especially whole fruits, grains, at least half of which are whole grains, fat-free or low-fat dairy, protein foods, including seafood, lean meats, and poultry, eggs, legumes, for example, beans and peas, unsalted nuts and seeds, and soy products and oils. According to an article by the University of Delaware, research shows that access to affordable, healthy food promotes better nutrition and healthy eating habits. There are several barriers that limit access and availability of healthy foods. These are living in a food desert, the distance to grocery markets, the types of markets available, affordability, and the lack of transportation. These barriers are all disparities felt in low-income communities. What is a food desert? Well, according to the USDA, a food desert is a community, particularly a lower income neighborhood, where residents have low or limited access to affordable, quality, and nutritious foods. Food deserts are likely to have a higher share of convenience stores and small food markets. The types of markets available, as discussed, are typically convenience stores and small food markets. These types of markets usually carry foods of lower nutritional quality in comparison to larger supermarkets, which may carry a wider options of healthy food. Affordability of healthy foods, if available, tend to be more expensive than less nutritious options available. As stated in Healthy People 2020, research shows that low-income groups tend to rely on foods that are cheap and convenient to access. The distance to grocery markets in a community that have healthier food options may have a cost that is more affordable, but becomes a challenge for many individuals in low-income communities. If it's not within walking distance, this may not be an option for many within these communities. Because of the distance to larger supermarkets, the lack of transportation plays a significant role in acting as a barrier to healthy food access. Lack of transportation includes not owning a vehicle, or the cost or access to public transportation, or even just the time that it takes to travel to a larger supermarket may be too much for some individuals in a community. So traveling to a grocery store could entail out-of-pocket expenses that are too high for many individuals to pay. Several strategies to improve healthy food access include: first, state food policy councils. These councils work with state and local governments to develop policies to improve access to healthy, affordable food by developing food policies and food programs. These policies can indirectly lead to the development of community and school gardens, increasing enrollment in food assistance programs, and new forms of insurance for small local producers. According to the CDC, improvement of healthy food access through by advancing implementation of food service guidelines through communities and states can, by connecting people to healthier foods, by addressing transportation gaps in communities. Examples of this would be to establish accessible and connected pedestrian and bicycle networks that link to sources of healthy food. Another example would be to create ordinances and zoning regulations that permit local food sources like farmers markets and community gardens and community supported agriculture in more areas. Also, by using incentives to corner stores and mobile food vendors to sell healthy foods by offering reduced permit and licensing fees. Another example would be to work with partner organizations to establish local food banks for nearby residents. And addressing the transportation issue would be to work on providing public transit that modifies its routes to provide practical and accessible connections to healthy food retailers. Another recommendation by the CDC is to increase healthier food offerings in food service venues by encouraging vendors to procure healthier foods and by helping food pantries provide healthier foods. Another recommendation by the CDC is to bring partners together to link local food hubs to organizations that sell or serve food in low-income communities. Local access to healthy foods include mobile markets. Mobile markets provide healthy foods in areas that have poor access to supermarkets and grocery stores. According to an article by Community Commons, mobile markets that accept SNAP and WIC benefits is an important component of making healthy food more affordable. Farmers markets and farm stands supply local access to food and support local food production. Helping farmers markets and food stands qualify for accepting SNAP and WIC benefits will help improve access to low-income individuals. Community-supported agriculture. This is a program that allows residents in a community to buy shares of produce at the beginning of the season in return for regularly supplied boxes of mixed produce from the local farm. Community gardens. Cities provide areas for communities to collaborate to grow fruits and vegetables. Cities need to create specific zoning and ordinances that allow allow for the creation of community gardens. Farm to Institution. It's a program to bring local produce to, for example, schools, hospitals, restaurants, and grocery stores. With communities working together with state and local governments to promote programs such as the ones discussed, more low-income communities will benefit from increased access to healthy food choices. Please pause the video to take the post test by using the link under the video. This slide has some local Washington State resources for programs that work within communities to provide healthy food, such as GRUB, Growing Healthy Food, People and Community, and the Second Harvest. Also, I have given 2 sites that are guides to starting community programs within your own community, such as Healthy Food Access, the University of Delaware, a complete community toolbox, and the Centers for Disease Control and Prevention have a pamphlet for healthier food retail. It helps you to begin the assessment and start the process in your own state or your own community. This slide is a list of references used to complete this discussion. At the bottom of the video is a link to a pamphlet regarding the discussion for you to read or print. Thank you.